Here's a list of my courses, and let's choose the course talking about the USMLE cases and quizzes. And let's scroll down the cases and choose, for example, this one. Today we have a prisoner complaining of shortness of breath and mild cough for 2 weeks. His symptoms have been persistent and non-progressive. His cellmate is also complaining of similar symptoms. A PPD test showed 4 centimeters in duration after 24 hours. Chest X-ray showed diffuse infiltration across both lungs. The patient insisted that his symptoms are mild and non-disturbing to his lifestyle. So the question asks, which of the following is the best next step? So let's look at the key features. We have a prisoner, and we know that he has shortness of breath and cough. Chest X-ray showed diffuse infiltrations bilaterally, and that his lifestyle is mildly affected. All of these are very consistent with Mycoplasma pneumonia. Mycoplasma pneumonia causes the walking pneumonia. In this condition, the patient's X-ray findings tend to be much worse than their symptoms. It is very common with closed environments and closed societies, so we see it more common with soldiers and prisoners. It can be simply treated with azithromycin, tetracyclines, or doxycycline. It is called walking pneumonia because the patient have pneumonia symptoms, and walking because they can walk easily as if they had no symptoms at all. But when you do chest X-ray, you will see very severe signs. In other words, the hallmark of this condition is having very bad X-ray image, but the patient's symptoms and lifestyle is mildly affected. And here are the guidelines if you want to look at them. I'll have them in the description. So if you go back to the question, we now know that the patient has Mycoplasma pneumonia and that tuberculosis was a distractor. And indeed, we do see azithromycin as one of the options. Use the link below to get access to the full course, including many cases and hundreds of quizzes. Everything in the course is high yield and common topics that we see frequently in the exams. Basically, we sat down and looked through a large number of question banks, quizzes, and many repeated exams. The topics we've chosen for this course are the most repeated topics, so they are very, very common. Thank you for watching.